Welcome to the deep dive. Today, we're really zeroing in on something often overlooked, but honestly profoundly vital in modern surgery.
That's right.
We're talking about the instruments that clamp and occlude. Now, these aren't just tools. You could almost think of them as like the meticulous gatekeepers of laparoscopic procedures.
That's a great way to put it. They maintain absolute control inside the body during these incredibly delicate operations.
Exactly. And our mission today in this deep dive is to really explore the nuances of these critical instruments, understand why they're so indispensable, why they're fundamental to today's minimally invasive practices.
Yeah.
Think of this as your sort of direct route to getting well informed about a really fascinating and essential part of surgical innovation.
It really is a realm where precision and reliability aren't just, desired, they're absolutely demanded. Understanding these instruments helps you appreciate that amazing blend of technology and human skill in contemporary surgery.
And that ultimately means better patient safety and recovery, right?
Absolutely. That's the bottom line.
Okay, perfect. So that sets the stage really well. Let's start by unpacking this absolute imperative of control in laparoscopic surgery. Why is clamping and occluding just so critically important in this specific surgical environment?
Well, when we talk about laparoscopic surgery, you have to remember we're operating through tiny little incisions. We're using long, slender instruments and often looking at a magnified view on a video screen.
Right, it's not like open surgery at all.
Not at all. The environment itself, this confined space, often created using gas and pneumoperitoneum, it presents unique challenges right from the start. Within that limited view, and with much less tactile feedback, the need for absolute, just uncompromising control becomes paramount.
So the minimally invasive nature itself actually dials up the need for these instruments to work perfectly because you don't have that direct hand in their control.
Precisely. The surgeon's primary responsibilities are incredibly high stakes, and these tools are really extensions of their hands and their will. First, and arguably the most crucial thing, is controlling bleeding. Exactly. Hemorrhage is a major concern in any surgery, but in laparoscopy, even what seems like minor bleeding can very quickly obscure that magnified view.
Yeah, I can see that.
It makes it impossible to see vital structures. It increases the time the operation takes. And, uncontrolled bleeding can lead to serious complications for the patient needing blood transfusions or even life-threatening situations. So managing any vessel that bleeds quickly and effectively is just non-negotiable.
I can just imagine how a tiny bit of blood looks huge under magnification, becoming a real wall you can't see past. Okay, so controlling bleeding is number one. What else are these instruments doing?
Well, beyond hemostasis stopping the blood flow, there's the equally vital task of securing ducts. Think about structures like bile ducts or pancreatic ducts.
Okay.
These are really delicate pathways for essential body fluids. If they're not securely sealed off or ligated during a procedure, there's a huge risk of leaks.
Leaks into the body cavity.
Exactly. A bile leak into the abdomen, for instance, can cause severe inflammation, infection, a dangerous condition called peritonitis, which is inflammation of the lining of the abdomen. It can lead to all sorts of serious postoperative problems.
Wow, so it's not just about stopping bleeding right then and there, but also preventing these potentially severe issues after the surgery from leaks.
That's right. And then, closely related to securing ducts, is the prevention of spillage. This means containing any unwanted fluids, bile, blood, even intestinal contents, keeping them where they belong.
Keeping things clean, basically.
Essentially, yes. Any accidental spillage inside the abdominal cavity can lead to contamination, widespread infection, or, a whole cascade of other complications. It can turn a routine procedure into a really complex, prolonged, and potentially life-threatening emergency. So these instruments really are the surgical gatekeepers in the truest sense. They're designed meticulously to precisely regulate flow and connection inside the body, making sure what needs to be contained stays contained and what needs stopping is stopped, all through these tiny ports.
That phrase, surgical gatekeepers, really lands. Especially when you think of them working through these tiny windows into the body, it just underscores the incredible ingenuity needed. So how do surgeons achieve that level of precision and control with these tools, given, the whole minimally invasive setup? What kind of arsenal are we actually talking about?
Yeah, that's where surgical engineering really comes into its own. These instruments are basically sophisticated extensions, right? Each one is engineered for a very specific task with extreme accuracy. And we've developed a pretty diverse arsenal, tailored to tackle the different challenges of occlusion and clamping in various anatomical spots.
An arsenal of control. I like that. Okay, I'm really keen to get into the specifics. What are the main categories of these essential instruments that surgeons rely on?
We can broadly group them into 5 main types. Each has its own distinct characteristics, how it works, and where it's typically used.
Yeah.
We'll look at clip applicators, endoscopic staplers, endoloops, bulldog clamps, and these newer advanced energy sealers.
5 categories. Okay.
Yeah, and the variety itself tells you something about the diverse challenges surgeons face. But they're all united by that fundamental need for precise, reliable control.
All right, here's where it gets really interesting, I think. Let's start with clip applicators. You call them the Swift sealers. Why that name? Tell us about them.
Absolutely. Clip applicators are, they're among the most widely used occlusion tools in laparoscopy, and for good reason. Their popularity comes down to their speed and just exceptional reliability in creating a secure seal.
Okay.
They offer a really quick, effective mechanical way to ligate, which just means surgically tying off or binding vessels and ducts. They stop the flow of blood or other fluids.
So it's like a tiny permanent pinch clamp,
Hmm.
a physical closure. What are the common types we see?
Precisely. One of the foundational types are titanium clip applicators. These instruments deploy small U-shaped metallic clips, usually made of titanium. Well, it's chosen for its biocompatibility. The body tolerates it well and its strength. Their most common use is during a laparoscopic cholecystectomy. That's gallbladder removal.
Ah, okay. Very common procedure.
Very common. And specifically, they're used to ligate or seal off the cystic duct and the cystic artery.
Okay, why is ligating those specific structures so absolutely critical when taking out a gallbladder? I mean, what happens if that seal isn't perfect?
The implications are huge, really profound. The cystic duct, that's the main tube for bile flowing from the gallbladder. If it's not securely and completely sealed off, bile can leak into the abdomen.
Which leads to?
Leads to severe inflammation, painful fluid collections, infection, and potentially that life-threatening peritonitis we mentioned. Similarly, the cystic artery supplies blood to the gallbladder. If that's not properly ligated, you can get uncontrolled bleeding. And in that confined laparoscopic view, bleeding can quickly obscure everything, make the procedure longer, maybe even force an emergency conversion to open surgery, or cause significant blood loss needing transfusions. It really increases the patient's risk.
Wow.
So the precision needed to place these tiny little clips in that magnified, confined space, making sure the seal is complete and secure. It demands immense surgical skill and just unwavering attention.
Yeah, it really hits home that even something seemingly small, like applying a clip, requires absolute mastery. Now, you mentioned an evolution. Hem-o-lok applicators, how are they different from the titanium ones?
Indeed. Hem-o-lok clip applicators definitely represent an advancement. While titanium clips are usually single-use and metallic, Hem-o-lok systems often have reusable applicators that deploy polymer locking clips.
Polymer, okay, so
Yeah.
plastic, basically. What's the advantage there?
Well, the polymer material offers several advantages. For one, polymer clips are generally radiolucent, meaning they don't show up much or cause distortion on X-rays or CT scans. This reduces artifact on any postoperative imaging, which can be really important if follow-up scans are needed to check things out.
Ah, that makes sense. A big practical benefit for follow-up care. And you said locking clips. How does that locking mechanism improve the security compared to just a standard titanium clip?
Yeah, the locking mechanism is specifically designed to give an even more secure, durable occlusion. Once they're placed, these polymer clips are engineered to snap shut and really hold their position firmly. They resist getting dislodged or accidentally opening.
So extra security.
Exactly. This makes them particularly good for situations involving, say, larger vascular pedicles. Those are bundles of blood vessels supplying an organ or larger ducts where you need an absolutely robust, unwavering seal. So while both titanium and Hem-o-lok clips are quick, secure, relatively easy to use, the Hem-o-lok offers that different material, the radiolucency, and that enhanced security of the locking feature. It's often preferred in specific, sometimes more challenging scenarios, perhaps with larger vessels.
So if we step back, what this means for the patient and the surgeon is having these versatile, reliable options. The choice between titanium and polymer locking clips really sounds like it boils down to the specific anatomy, the size of the structure, maybe the need for future scans, and I suppose surgeon preference too.
Exactly right. It highlights a tailored approach.
Yeah, tailored for safety and efficiency.
Precisely. The availability of these different options lets surgeons match the tool perfectly to their requirement, optimizing the outcome.
Okay, let's move on to category number 2. Endoscopic staplers. Now, these sound like they add a whole new level of function by combining occlusion with division. That seems like a pretty big leap from just clamping, right?
It absolutely is a significant leap. Endoscopic staplers are, they're true workhorses in modern surgery. They offer this powerful dual function. They don't just occlude tissue, they simultaneously divide it.
Wow.
And this capability is vital in procedures where you need to resect or transect large sections of tissue with minimal blood loss and maximum efficiency, all while creating a sealed closure.
That simultaneous action, sealing, and cutting, it sounds incredibly efficient for the really complex stuff. How do they actually work, and where are they mainly used?
Right, there are two main types. First, you have linear staplers. These instruments are designed to place multiple parallel rows of tiny staples on either side of the tissue line.
Okay.
Then, as the staples are deployed, a blade simultaneously cuts the tissue precisely between those staple lines. You can almost picture it like building two sealed fences right next to each other and then cutting a path right down the middle, sealing both edges perfectly as it goes.
That's a great analogy. Creates two sealed edges, then cuts all in one go. Where would you typically see these being used?
Their key applications are in major gastrointestinal procedures, things like bowel resection, where you need to remove a diseased section of intestine.
Right.
They're also indispensable in bariatric surgeries, like sleeve gastrectomy, where a large portion of the stomach is removed. If you analyze their impact, this simultaneous cutting and stapling saves an enormous amount of time.
I bet.
It minimizes how much raw tissue surface is exposed, which is critical in complex resections involving long lengths of tissue. It helps prevent contamination and significantly cuts down operative time. And the uniform, secure closure from those multiple staple rows is just absolutely critical for preventing leaks from the cut bowel. A leak there, as you can imagine, would be catastrophic, leading to severe infection.
Yeah, absolutely. So connecting this to the bigger picture, these tools really enable complex resections with a speed and safety that, frankly, was probably unimaginable not that long ago. It must significantly reduce patient trauma and recovery time for those kinds of major surgeries.
Without a doubt, they've been transformative. Then the second type are circular staplers. These have a very unique specialized role. Their primary job is to create what's called an end-to-end anastomosis.
Okay, anastomosis, could you just quickly break that down for us? What does that mean in this context?
Sure. Anastomosis is simply the surgical connection of two hollow or tubular structures. So in colorectal surgery, which is where circular staplers are mostly used, it means precisely rejoining two ends of the colon or rectum after a section has been removed, maybe because of a tumor, for example.
Yeah, okay. Reconnecting the pipe, essentially.
Exactly. The circular stapler creates a sealed, robust, continuous connection. It forms a new continuous passageway, or lumen, minimizing the risk of leakage and promoting good healing. The circular design ensures an even, strong seal all the way around the circumference of the joint tissues, which is vital for maintaining bowel function.
That's incredibly clever engineering. It sounds like staplers, both the linear and the circular types, offer these huge benefits of speed, really effective hemostasis, that bleeding control, and a very uniform closure, especially in those really complex resections where time and precision are absolutely critical.
Absolutely. They've revolutionized many gastrointestinal and thoracic procedures, making them far safer and more efficient. The transition from meticulous hand suturing, which could take a very long time and demanded an incredibly high degree of skill. Well, moving to stapling has fundamentally changed the landscape of these operations.
Yeah.
It doesn't just save time, it standardizes the quality of the closure, leading to more predictable, generally better patient outcomes.
Okay, let's shift gears slightly. Moving on to our third category, endoloops. This sounds much simpler, maybe more traditional compared to the high-tech staplers we just discussed. What exactly is an endoloop?
An endoloop is indeed simpler, but it's remarkably effective. It's essentially just a pre-tied suture loop that's introduced laparoscopically on an applicator. It's one of those elegant solutions that proves, not everything needs complex machinery to be highly functional in surgery.
So it's literally a preformed knot on a stick that you can slip over something. How does the surgeon actually use it?
Exactly that. It's a length of suture already tied into a loop, usually loaded into a thin applicator. The surgeon maneuvers this loop around the target structure, say the appendix during an appendectomy, or the septic duct again, or maybe a small bundle of vessels, a small vascular pedicle.
Okay.
Once it's positioned correctly, there's a mechanism on the applicator that lets the surgeon tighten and secure that knot around the structure, effectively ligating it. It relies on simple mechanical constriction, just like tying off a package, really.
So what are the strategic advantages then? When would a surgeon choose an endoloop over, say, a clip or even a small stapler cartridge?
Well, its main advantages are its cost effectiveness, its proven efficacy over decades,
Yeah.
and its usefulness in situations where maybe staplers or clips just aren't ideal.
Okay, why wouldn't they be ideal? What kind of situations are we talking about?
Right, good question. There are several scenarios. Sometimes the size or the delicate nature of this structure or the anatomy right around it might make a rigid clip too bulky or too difficult to place just right, maybe even potentially damaging.
Hmm.
For example, a very small, thin pedicle might actually be better suited for the gentle tightening of an endoloop rather than the crushing force of a clip.
Mm.
Other times, specific anatomical constraints, maybe you're working in a very narrow space like deep in the pelvis or at an awkward angle, could make it really challenging to maneuver a bulky stapler or clip applicator properly.
Right. Access can be tricky.
Exactly. Endoloops are also incredibly valuable in settings where cost-effectiveness is a major factor. They allow for high-quality, safe ligation with fewer resource demands compared to some of the more complex devices.
Hmm.
So it offers this versatile, low-tech, but highly effective alternative when those other instruments aren't the best fit or perhaps aren't readily available.
That's really fascinating. The point about simplicity and versatility does raise an important question, doesn't it? In a field that's constantly pushing for the newest tech, how vital is it to keep refining and using these simpler, more elegant solutions like the endoloop? Does it suggest that the best tool isn't always the most complex one?
It absolutely does. It highlights a really fundamental principle in surgery.
Yeah.
Effectiveness and safety are paramount, always. But the tool you choose has to be appropriate for the specific clinical situation you're facing right then.
Right.
Sometimes, the simplest, time-tested solution is the most reliable and effective. It proves that practical utility often trumps, technological flashiness. It's about optimizing patient outcomes with thoughtful choices, not just expensive ones.
Well said. Okay, our fourth category, bulldog clamps. The name itself makes me think of something with a really strong, tenacious grip, but maybe temporary. What's their main job in laparoscopy?
Bulldog clamps are pretty much, as their name implies, small, spring-loaded clamps, but their purpose is very distinct and crucial. They are designed to temporarily occlude vessels.
Ah, temporary. Okay, that's the key difference.
Yes, a very important distinction from the permanent sealing we talked about with clips and staplers. These are meant to be put on, hold tight, and then be taken off without causing any damage to the vessel.
So it's not about cutting off flow forever, but more like pausing it, like putting a temporary dam in a river so you can work downstream. Where are these typically used?
Exactly like that. Their main use is in laparoscopic vascular surgery, or in procedures where a surgeon needs to briefly stop blood flow in a vessel to do a delicate repair, maybe suture a tear, or perform other precise maneuvers in a field that's free of blood.
Okay.
The unique benefit of bulldog clamps is their design. They allow for controlled, reversible clamping without damaging the vessel wall. This atraumatic grip is absolutely essential in vascular surgery. You have to maintain the integrity of the vessel lining, the endothelium, to safely restore blood flow afterwards and prevent future problems like clots or thrombosis.
So they come in different types.
Yes, they have different jaw patterns, different spring pressures, all designed to match the specific vessel size and how fragile it is.
That's incredibly important, the reversibility without damage part. What's really fascinating here is that ability to just momentarily pause blood flow for delicate work and then confidently restart it, like a precision traffic light for the body's internal highways. How does the surgeon make sure that temporary hold is strong enough but also completely non-damaging?
Well, that comes down to the specific design of the clamp itself. They often have very finely serrated jaws, but they're blunt, or sometimes smooth jaws lined with a soft material like celastic. They're designed to spread the pressure evenly and minimize trauma.
Okay.
The spring tension is very carefully calibrated, just enough force to occlude, but not enough to crush the vessel wall. The surgeon picks the right size and jaw type based on the vessel's diameter and thickness. It's this controlled reversibility that's the hallmark of precision vascular work, letting surgeons operate in a clear field for repair and then confidently restore circulation, knowing the vessel's health is preserved.
Right. Got it. Okay, and finally, let's talk about the cutting edge, maybe literally here, advanced energy sealers. These sound like the multitasking marvels really pushing the boundaries in modern laparoscopy.
They certainly are. Advanced energy sealers represent a really significant evolution in surgical tech. They bring highly sophisticated energy devices into play for permanent tissue sealing and division. They're definitely a hallmark of modern laparoscopy and have fundamentally changed how surgeons manage tissue.
Can you give us some examples? What are these high-tech tools and what can they do?
Sure. Prime examples would be devices like ligature and thunderbeat. These are incredibly powerful and effective tools.
How do they work? What kind of energy?
They use different forms of energy. Ligature typically uses bipolar radiofrequency energy. Thunderbeat actually combines ultrasonic energy and bipolar radiofrequency. Their really impressive capability is that they can reliably seal vessels up to 7 millimeters in diameter.
7 millimeters. That sounds quite large for sealing with just energy in a minimally invasive way.
It is a considerable diameter. It signifies a serious amount of power and precision, allowing for a robust, consistent hemostasis or bleeding control on fairly substantial vessels.
And you mentioned multitasking earlier. What's the most compelling feature that makes them stand out?
Yeah, their most compelling feature, what makes them true marvels, really, is their integrated functionality. These devices combine the functions of clamping, sealing, and often cutting, all within a single instrument.
Whoa!
So imagine the efficiency gain. Instead of needing, say, a grasper to hold the tissue, then bringing in a separate energy device to seal it, and then maybe scissors or another instrument to cut it, one instrument can potentially do all three steps.
Okay, so what does this all mean? For the surgeon, and maybe more importantly for the patient, less instrument swapping must translate directly into saving time, maybe safer procedures.
Absolutely. The efficiency gained from integrating multiple functions is substantial. It can significantly cut down the operative time.
Which is always good.
Always good for the patient. Reduces anesthesia exposure, potentially lowers the risk of infection, less overall stress on the body. It also simplifies the whole surgical workflow, makes the procedure smoother. It potentially reduces risk by minimizing interruptions, instrument clutter in the field, and maybe even the chances of error during instrument exchanges.
And for the patient outcome.
Well, ultimately, it can mean faster recovery, less post-operative discomfort. The underlying principle is using controlled energy RF or ultrasonic or both to basically denature the collagen and elastin in the vessel walls, fusing them together.
Ah, like welding them shut.
Kind of like welding, yes. It creates a permanent, strong seal, often with minimal thermal spread, meaning less heat damage to nearby tissues. It really represents a significant leap in surgical efficiency and power, allowing faster, potentially safer tissue management, especially in complex cases with lots of vessels to deal with.
That's a really comprehensive overview of the arsenal. It's quite impressive. But with so many sophisticated tools available, clips, staplers, loops, bulldogs, energy devices, it begs the question, how does a surgeon actually decide which instrument to use for a specific vessel or duct or piece of tissue? What are the key things they're weighing up in the operating room?
That is an excellent question. It really gets to the heart of the art and science of surgery. Instrument selection isn't just random. It's a careful calculation based on several critical factors. Firstly, the tissue type and thickness are absolutely key.
Okay.
A delicate, thin-walled structure, like the cystic duct we keep mentioning, might be perfect for a precise little clip or maybe an endolip. But contrast that with thicker, more vascular tissue, like a major bundle of vessels or a section of bowel that's going to demand the robust sealing and maybe division capabilities of an endoscopic stapler or one of those advanced energy sealers.
So the physical nature of the tissue itself is a major deciding factor.
Exactly. Secondly, the vessel or duct diameter is crucial. Small vessels might be fine with a clip or certain energy sealers, but for larger vessels or broader sections of tissue that need cutting at the same time, then staplers or the high-power energy devices become pretty much indispensable. That 7 millimeter sealing capacity we talked about for energy devices, for example, that's a real game changer for bigger structures.
Makes sense. And what about the location, given the tight spaces and laparoscopy?
Right, that's our third factor. Anatomical constraints and accessibility. Some spots in the body are incredibly tight or they're really awkward angles. In those situations, trying to get a bulky stapler in might just be impractical or impossible.
Yeah.
So here, a slender endoloop applicator or maybe a clip applier that has more articulation, more flexibility at the tip might be the only workable options. And bulldog clamps, of course, with their temporary hold, are uniquely suited for vessels you need to isolate for a bit without cutting them permanently.
So the surgeon is almost like a sculptor, constantly choosing the right tool for the specific curve or texture of the material they're working on, in this case, the body. Are there other factors, maybe less obvious ones, influencing the choice?
Oh, absolutely. Fourthly, you have patient-specific factors. These can play a role. For instance, if a patient has a known allergy to certain metals, that would obviously rule out certain types of clips.
Good point.
Also, like we touched on, the potential need for future diagnostic imaging might make a surgeon lean towards those radiolucent polymer clips instead of metallic ones, just to avoid imaging artifacts down the line. Fifth, and this is just pragmatic, cost and availability of instruments can sometimes be a factor,
Right, the practicalities.
especially in perhaps resource-limited settings. A reliable and inexpensive endoloop might get prioritized over a more costly single-use stapler as long as it offers equivalent safety for that particular task.
That makes perfect sense. Healthcare resources are always part of the equation. And what about the surgeon themselves, their own background?
That's a critical sixth factor, surgeon preference and experience. Surgeons, naturally, develop proficiency and comfort with certain instruments over their training and career. While all surgeons are trained on a wide range, they often develop a preferred device for specific situations because they really understand its nuances and how to get the best results with it.
Ah, okay.
So yeah, it's a really dynamic decision-making process. It integrates the science, the anatomy, the technology, the practical considerations, and that element of surgical art or experience, all aimed at getting the safest, most effective outcome for that individual patient.
That brings us to, well, an incredibly crucial aspect of all this, safety. We've covered a lot of amazing technology, really ingenious solutions today. But all this advanced instrumentation, all these selection criteria, they all point to one fundamental thing. Safety has to be absolutely paramount when you're working with clamping and occluding instruments, doesn't it?
It is. Without any exaggeration, it is the single most important consideration. While these tools are incredibly advanced, incredibly reliable, even with the best instruments, it's human vigilance, meticulous technique, and just strict adherence to safety protocols that are the ultimate safeguards in the operating room. The stakes are just far too high for anything less.
So what are some of those critical safety guidelines? The things surgeons and their teams must rigorously follow to make sure these gatekeepers do their job perfectly and prevent any potential complications.
Okay, well, one of the most fundamental guidelines, a cornerstone really, is clip placement verification. Surgeons must always, without exception, double-check clip placement before dividing any duct or vessel. This isn't just a suggestion, it's a critical, mandatory step in almost every procedure involving ligation.
Why is that double check so incredibly vital? What are the potential, maybe catastrophic consequences if a clip is slightly off or a structure gets divided too soon and it goes unnoticed? Can you maybe paint a picture of a worst-case scenario there?
The consequences can be absolutely devastating. They can lead to what surgeons sometimes call a never event, an error that simply should never happen. Imagine, back to the gallbladder surgery, the laparoscopic cholecystectomy. If a clip on the cystic duct isn't placed perfectly, maybe it's caught on a fold of tissue, maybe it doesn't fully go across the whole duct and the surgeon then cuts the duct.
Oh,
You
dear.
could have an immediate, uncontrolled leak of bile right into the abdominal cavity. This isn't minor. It risks severe peritonitis, organ damage from the corrosive bile, a cascade of infections. Now think about a major blood vessel. If a clip isn't secure and the vessel is divided,
Massive bleeding.
massive, potentially life-threatening hemorrhage. And trying to control that in the confined laparoscopic space is incredibly difficult. It might force an emergency switch to open surgery, require extensive blood transfusions, and in the worst case, could even lead to loss of life. So that double check, it's literally the last critical line of defense against severe, avoidable harm. It relies entirely on the surgeon's eyes and critical judgment.
Wow. That really makes the importance crystal clear. Okay, what about staplers? They're complex mechanical devices. What are the key safety checks there?
Right, with staplers, it's imperative to ensure the jaws are fully closed and the device fires properly. The mechanical precision is remarkable, but they depend on perfect alignment and complete function. Before firing, the surgeon has to visually confirm the tissue is correctly positioned within the jaws and that the jaws are completely closed,
Why is full closure so important?
because it indicates proper compression of the tissue. If the jaws aren't fully closed, the staple lines might be incomplete or uneven. That can lead to poor hemostasis, continued bleeding, or worse, leakage from the cut tissue like a bowel connection and anastomosis. And if the device itself misfires,
Misfire.
if it doesn't deploy the staples correctly or the blade doesn't cut properly, you could have an incomplete transection. The tissue isn't fully cut or sealed. That might mean the surgeon has to reposition the stapler, use more staples, maybe switch to a different method entirely. All of that prolongs the surgery, involves more handling of the tissues, and introduces extra risks. It's really about confirming the mechanical integrity, the readiness, before taking an irreversible step.
So it's not just pushing a button. It's like doing a comprehensive pre-flight check on the machine before takeoff.
Exactly. A very good analogy. And then, once the action is taken, whether it's clipping, stapling, or using energy, the next crucial safety step is visual hemostasis confirmation. After sealing or clipping a vessel or duct, the surgeon must visually confirm absolute hemostasis, absolute stopping of bleeding before moving on to the next part of the operation, and definitely before closing the patient up.
Why is that direct visual check and maybe even, as you suggested, waiting and watching for a moment so critical here? Does that waiting period prevent a specific kind of problem?
It's crucial because sometimes a seal might look okay right at first, but maybe there's delayed bleeding or slow oozing that could start up if the occlusion isn't perfectly robust. Or maybe a tiny branch off the main vessel wasn't quite caught in the seal.
Ah, okay.
Direct visual inspection lets the surgeon make absolutely sure there's no active oozing or bleeding from the site. And yes, critically, waiting and observing for maybe a short period, perhaps a minute or two, confirms that the seal is truly secure. It ensures there are no tiny, maybe pressure-dependent leaks that might only become apparent later when the patient's blood pressure normalizes after anesthesia or if they cough. It's that final critical check that the gatekeepers have truly done their job before attention shifts elsewhere. It prevents a nasty surprise hours or days later.
Got it. And finally, with those really powerful advanced energy sealers, the ones using RF or ultrasonic energy, what specific cautions are needed there to prevent unintended harm given the different physics involved?
Yeah, with energy devices, extreme caution is absolutely necessary because of the principle of energy conduction. Surgeons must avoid activating these devices too close to any metallic clips or stents that might already be in the patient's body, or maybe were just placed moments before.
Why is that? Does the energy jump?
Essentially, yes. The energy radiofrequency or ultrasonic can conduct through metal. So if an energy device is fired too close to a metal clip or a stent, that energy can transfer through the metal and cause unintended burns, tissue damage, or thermal injury to adjacent vital structures, or even to the vessel the clip is on. This happens even if the energy device isn't directly touching the metal object.
Wow, that's a serious risk.
It is. It could lead to really serious, entirely avoidable complications like perforations, holes, fistulas, abnormal connections, or other thermal injuries. It just requires constant awareness from the surgeon of the entire operating field and any metallic implants that might be present.
This whole discussion on safety, it truly highlights the intense focus on detail, the constant critical thinking that's required in the operating room. Even with the most advanced, almost futuristic tools, it still comes down to human expertise, meticulous attention, and a deep understanding of the physics and the biology to keep the patient safe. It's not just about using the tools, it's about understanding their power and limitations in real time.
It is precisely that. It's a sophisticated, intricate dance between cutting-edge technology and unparalleled human skill and judgment. Every decision, every single movement has a direct and profound impact on the patient's well-being. Precision and caution aren't just, preferences. They are absolute mandates.
Well, as we bring this deep dive to a close, it's really remarkable to just step back and reflect on the sheer ingenuity and the diversity of these instruments we've talked through today. From the swift, reliable seal of clip applicators and the precision cutting and closing of endoscopic staplers to the simple yet incredibly effective endoloops.
Yeah, the elegant ones.
Exactly. Then the controlled, temporary hold of bulldog clamps, and finally the multitasking power of advanced energy sealers. Each one really plays a unique, completely indispensable role in the modern OR.
Indeed. Taken together, these instruments are absolutely fundamental. They are those silent, steadfast guardians, maintaining hemostasis, controlling spillage, securing vital pathways, really, the very foundation of safe and effective laparoscopic surgery. Without these surgical gatekeepers doing their jobs flawlessly,
Whoa.
minimally invasive surgery, with all its amazing patient benefits, smaller scars, less pain, shorter hospital stays, quicker recovery, it just wouldn't be possible.
Or unsafe.
Little unsafe, exactly. They are truly the unseen heroes that empower surgeons to perform these incredible feats of precision inside the human body.
And considering that incredible precision and control they already provide, and the constant innovation we see combining functions, enhancing safety features, it really makes you wonder about what's next, doesn't it? Imagine how these surgical gatekeepers might continue to evolve. What further refinements could we see? Maybe integration with robotics for even finer control, or AI providing real-time feedback. Perhaps entirely new materials or energy sources could emerge to make these critical functions even safer, even more efficient. It feels like we're constantly pushing the boundaries of what's possible for patient care and recovery.
It's a truly thought-provoking vision for the future of surgical precision. Absolutely. It's an exciting field to watch.
It certainly is. Well, thank you so much for sharing your expertise on this deep dive.
My pleasure. Thank you for having me.
And thank you all for listening. Until next time, keep digging deeper into the fascinating world around us.